Hello, my name is Angela Goodrich, and I am the administrator here at Good Nursing and Medical Training. And today I want to welcome you to our medical assistant orientation. This is part one. Welcome to Good Nursing and Medical Training. We are here in Georgia, located in Norcross, Georgia, and we do have a website where you can learn more information about the location. We are in a business office location. Our school has been here in existence for the past 12 years, and we offer programs such as nursing assistant, medical assistant, phlebotomy, EKG, PCT, and other programs as well. We do have a staff of myself being the administrator, and we do have other staff members, teachers as well. We have a teacher primarily for the medical assistant program, and we do have some assistants for that program as well. We have a dedicated office assistant primarily for medical assistant classes like EKG, phlebotomy, and PCA, Miss Samantha Holiday. We also have an office manager. Her name is Rebecca Goodrich, and we are here to help you get through this medical assistant program. Our medical assistant program was approved by Georgia Non-Post-Secondary Education Commission, and we have other programs that were approved by other national or state bodies. Our medical assistant program is 14 weeks. It's considered a hybrid class, and with that, students are assigned reading materials weekly, an assignment, and testing, and the testing is done here at the school. Let me just explain the flow of the medical assistant class. For the first 4 weeks, 3 to 4 weeks, it is a 3-day class. 1 day is for lecture, where we will review the content that you were supposed to have read. So the instructor will go over the reading materials and also help you to review your answers of your assignments, your workbook assignments. That's when you come in. And then after your review on that Monday, the instructor will give you your assigned test. And you will do your testing here at the school. On Wednesdays when you come, that's your lab day. Instructor will, of course, review content again for the week, and she will demonstrate skills for you to learn and expect to have from you return demonstrations on the skills. That's pretty much your lab day. For the first 3 to 4 weeks, this will happen. And then on Fridays when you come in, you will review more content. Now in the 4th week, it changes. In the 4th week, you will have a class day where you'll come in for lecture and review and testing. And then you'll come on Wednesday for labs still. And then the 3rd day of the week, you'll go to clinical. And clinical is in the doctor's office, health center, wherever we can assign you for your clinical rotation, we will send you. And that day was a little bit flexible last class. So generally speaking, the clinical day is held on Fridays. So in moving along from the 4th week until the end of the program, you will do 1 class day, 1 lab day, and 1 clinical day. So you'll come to the school twice a week, 1 for lecture, 1 for lab, and then you'll go to the clinical site for your clinical rotation. In the medical assistant class, we are going to work with a lot of skills, a lot of basic care skills. We will go over insurance, medical billing and coding, medical terminology, A&P, anatomy and physiology. We will go over all the systems, pointing out the various disease processes and the work that the medical assistant will do pertaining to that particular body system. We will also be teaching you lots of skills for phlebotomy, lots of skills for EKG, many skills for office management, office equipment, and in the coming around to the end, round about the 13th week, we will be teaching you a little bit more about medication administration, patient teaching, and you will get to apply a lot of these skills that you're learning in the school in the clinical area from the beginning. Now, that's a wonderful opportunity for our school because you get to go in clinicals as early as the 4th week, where you will be precepted or mentored by a medical assistant in their facility. These are all clinical agreements, and the doctor's office, as long as they have signed the agreement, they're being given very specific directions on how you are to proceed in the clinical area. We, the instructors, also follow up with the clinical staff to see your progress and to deal with any matters that may come up. So that's the review of the class, and it kind of tells you how the class is going to go and some of the content. Now, to get ready for clinicals, we ask that you be specifically ready by the 3rd week. The clinical sites, and we have agreed, have asked us to ensure the student is ready for clinicals. So let's discuss clinical readiness for clinicals. You must have a drug test. You must have a background check. You must have hepatitis B series started. You must have your TB test. You will have your CPR, BLS, American Heart Association, drug testing. I may have repeated myself, but pretty much we'll go over it with you again in class. Clinical documents must be in our possession by the 3rd week. So we ask that you get your documents ready and be prepared, because we're going to have to send you to the clinical site with your documents. We bring the documents to the clinical site, and we have to do so before you go to the clinicals. You do not carry your documents, we carry your documents. And most clinical sites are asking for us to submit a resume, because they're starting to think if we allow you to come, if we are teaching you, they may want to hire you, So we ask that you get your clinical documents together as well as a resume, and hopefully you'll be the best presentation when you go into the clinical site. In the classroom, while you're here, we give you scrubs. We give you 2 pairs of navy blue scrubs, and we expect you to wear your navy blue scrubs in class and in clinical. That's why we give you 2 pairs. You will wear your clinical scrubs to clinical, and I hope everyone understands professionalism in the workplace, because you have to be absolutely professional in the workplace. And hopefully we'll see how you are in the first 3 weeks to advise you, encourage you, groom, and help you get ready for the clinical site. In the clinical site, there is no use of telephones. You make a confidentiality agreement about not sharing patient information, not taking pictures in the clinical site, not being on your phone in the clinical site, and you're pretty much being mentored or guided by the preceptor in the clinical site. We also ask that you get your hepatitis B series started. If I did not mention that before, you have to have a hepatitis B series commenced as you are going into clinicals. They just probably want to see the first dose and your plan to continue receiving your hepatitis B series. So your clinical rotations can change. We have secured a few sites, and one is an urgent care, one is a primary care, and we are in the process of securing a pediatric site. As we continue to grow our medical assistant program, we're looking for more sites so we can assign the students to various specialties while in the program. So as you come week to week, you will have opportunities to learn. We ask that you come to class. If you are not able to come to class, we ask that you inform the school by sending an email if you're not able to come. If it's a small amount of students, or if it's just one student in the medical assistant program, we're happy to have you. But you must let us know if you're not going to come, because we do not want the instructor coming to the school if you are not here. So more than contact the instructor, we want you to contact the school and let us know if you are not coming to school. While you are in the class for your labs, we will provide you a kit where you will keep together some of your materials like gloves. We'll give you a gown so you can wear that. We'll give you a jacket that you can wear, especially when you are collecting specimens. So we would want you to keep check of your little kit, but there are kits in the classroom as well for blood draws, for EKG. All your supplies are in the class already. So you don't really have to buy supplies for that, but the teacher will keep you abreast of what you need to submit, what projects you need to do, and we will get through the 14 weeks. Now, as you go along, and we'll give you lots of tests as you go along, but at the end of the medical assistant program, after 14 weeks, we'll give you a school final exam. We'll give you a school final exam round about the 14th week. And then in that week, we will also commence a review for your National Health Career Association exam. That's the national certification that you will do. And so we want to start with a review. We want you to start preparing for that with a review, and we want you to start your review here in this class. So you will have your review here started for medical assistant, and that comprises of some discussion, some questions, some content that we will share for you to be very prepared. There's also a crosswalk where the textbook gives you directions for the exam. The exam materials and the textbook materials, they coincide, and we'll give you a crosswalk for that to help figure it out, where to find information about that particular testing area or that particular topic on the exam. That's a crosswalk, and we'll give you that. Now, let's talk about job placement in orientation number 2 for the medical assistant program.